Hello and welcome to MLAbuddy.co.uk. Today I'll be walking you through a demonstration of one of our stations so you can start practicing. This is our main page. To find stations to practice, you want to click on the Start Practicing button. This will bring you to the page that has all of our stations where you can choose your scenario. Today I'm going to be working through a respiratory station. This station is called I'm Really Not Feeling Too Good. Now to use the site, you need to press the microphone to speak and record your analysis about the scenario. In this scenario, I am an FY1 in A&E. A 75-year-old woman has presented after becoming suddenly more unwell today after having a cough for the last week. My task is to take a history, explore any red flag symptoms, and advise on investigations and management. At the end, the examiner is going to ask me some brief questions. So let's start the station. Now, for my medical school, I get 8 minutes of station time and 2 minutes of examiner time. You can adjust this to follow your medical school protocols. Hello, my name is Dr. Lancaster, one of the junior doctors here in A&E. Can I just confirm your full name and date of birth, please?
My full name is Edith Johnson and my date of birth is 12th March 1948.
I understand you've started feeling more unwell recently. Can you tell me a bit about what's been going on?
Yeah, I've had this cough for about a week now and today I feel worse than before. I'm more tired and weak.
I'm really sorry to hear that. When did you first start feeling unwell?
I think it started about a week ago, maybe a little longer.
And has your cough changed recently?
Not really, it's just been there, but today it feels a bit tighter in my chest.
Oh, okay. And have you been coughing anything up?
No, I haven't really been coughing anything up, just the cough itself. It's mostly dry.
And when you say it feels a bit tighter in your chest, do you mean that you have chest pain or you're feeling more short of breath?
I wouldn't say it's pain, but I do feel a bit short of breath. Yeah.
And have you had any fevers or chills?
No, I don't have any fever. I just feel a bit weak and tired.
And with the shortness of breath, have you noticed anything that makes it worse?
I think it gets worse when I'm moving around too much or when I'm talking a lot.
And is there anything that makes it better?
Not really. It just feels the same most of the time. I've been trying to rest.
And have you felt any confusion lately?
Yeah, I've been feeling a bit confused, especially today. It's just hard to concentrate.
And any dizziness or fainting?
Oh, I've felt a bit dizzy now and then, but I haven't fainted or anything like that.
And have you felt at all like your heart is racing?
No, I haven't noticed that. It's more like just feeling weak and tired.
And have you had any change in your urinary habits?
Not really. Everything seems normal there.
Okay, and any chest pain that's sharp or worse on breathing in?
No, I wouldn't say it's sharp pain, just that tight feeling when I breathe.
And how far can you walk before you need to stop?
I can walk a little, maybe just to the kitchen and back, but then I feel really tired.
And have you noticed any wheeze when you're breathing?
No, I haven't noticed any wheezing, just the tightness and cough.
And is anyone else unwell around you?
Oh no, it's just me. I live alone, so I haven't been around anyone else.
Have you ever been diagnosed with any lung conditions or heart problems?
No, not that I know of. Just, the usual things with age.
And what are the usual things?
Just like arthritis and maybe some mild blood pressure issues, but nothing serious.
And have you had any recent hospital admissions?
No, I haven't been in the hospital recently.
Do you take any regular medication?
No, I don't take anything irregular, just my usual medications.
And what are those?
I take some for my blood pressure and a few others for general health, but I can't remember the names.
Any recent antibiotics?
No, I haven't taken any antibiotics recently.
Any allergies to any medicine?
No, I don't have any allergies to medicines that I know of.
And have you taken anything over the counter?
Just some cough syrup, but that's about it and nothing else.
Any family history of lung conditions or immune problems?
Not really, I don't think so. Just the usual health issues like heart problems in the family.
What sort of heart problems?
My late husband had some issues like angina and stuff like that, but I don't have those problems.
Okay. And do you smoke at all?
Oh, no, I don't smoke. I used to, but I quit a long time ago.
And how much did you used to smoke?
I used to smoke about maybe 10 day or so many years ago, but I stopped it's been over 20 years now.
Brilliant, that's great to hear. Do you drink any alcohol?
I have the occasional glass of wine or a sherry, but not much really.
And have you had any recent travel?
No, I haven't travelled anywhere recently, just been staying at home.
And do you live alone?
Yeah, I live alone. It's been a bit lonely lately too.
I'm sorry to hear that. Did you get any new pets or do you work somewhere that has lots of dust?
No, I don't have any pets, and I haven't been around dust or anything like that. Just been at home mostly.
Okay, and what do you think might be going on?
Oh, I'm not really sure. Maybe just bad cough, but I'm feeling a bit anxious about it all.
And is there anything in particular that you're worried about?
I'm worried it might be something serious, just not feeling like myself lately.
What were you hoping we could do for you today?
I was hoping you could help me figure out what's going on, and maybe make me feel better.
Okay, of course. Just a couple more questions. Have you had any vomiting or diarrhea?
No, I haven't had any vomiting or diarrhea, just the cough and feeling tired.
Any muscle aches or joint pains?
Yeah, I've had some muscle aches, mostly from not moving around much.
And any rashes or skin changes?
No, I haven't noticed any rashes or skin changes at all.
Thank you for answering all my questions. Just to summarise, you've had a cough and a fever over the past few days, and today you've suddenly become more short of breath with some chest discomfort. You also feel weaker and a bit more confused than usual. This is a bit concerning as it could indicate a serious infection in your lungs, and your symptoms suggest it might be affecting your whole body. Is it all right if I do some tests and start some treatment for you?
Well, yeah, that's fine. I just want to feel better, so whatever you think is best.
So this has been my history taking. I've finished early, so I can then click submit. Now the examiner is going to enter and we're going to answer some
Hello,
questions.
what differential diagnosis did you consider for this patient?
For this patient, I would consider a community-acquired pneumonia that has turned into sepsis. This is due to the abnormal observations and the clinical history that I've been given. I would also consider a pulmonary embolism, as this is a life-threatening diagnosis and I'd want to rule this out quickly. We could also consider pneumothorax, however this is unlikely due to the history she has given me.
How would you investigate this case further?
I would want to do an ABCDE assessment and monitor her vital signs using the NEWS2 scoring. I'd like to take bloods, including a full blood count, U's and E's, CRP, LFT, clotting, a venous blood gas to look at her lactate, and blood cultures before we give antibiotics. We would also consider a chest X-ray for consolidation and sputum culture if possible. We'd also assess using the KERB 65 score. We'd then want to manage if this is sepsis.
What immediate management steps would you take for this patient given her vital signs and presentation?
As I think this is sepsis, I'd want to initiate the sepsis 6 protocol. This is giving oxygen to maintain her oxygen saturations, taking blood cultures, giving IV antibiotics per local guidelines, giving IV fluids if she's hypotensive or has a high lactate, checking the lactate and monitoring urine output. I'd also want to escalate to senior.
Thank you for your time. You can check your results by pressing the submit button.
Again, I finished early, so I can press submit or I can wait until the examiner is done. This is how all of our stations will work. Once we're finished, the station will automatically mark your history and examiner questions. This may take a moment, so you need to wait. So you will be given an overall total score, global score, and an overall rating. For my assessment, I did not differentiate between community-acquired pneumonia and other types of pneumonia. This is important to do during the differential stage. However, I did manage to assess all of the red flags and had an overall good history. We did not specifically ask about medications that might mask symptoms, so the patient did say that she didn't remember her medications, but you should always push further to see if they do remember any of them. And I did not use the Socrates framework for pain assessment because the patient did not say she was in pain, but perhaps that tightness was pain. In the examiner feedback, you get a section about what you did well and areas to focus on next time, as well as an overall assessment. On the next stage, you can provide feedback, a 1 to 5 star rating, and suggestions if you want to.